All right, let's talk about specific drug classes. The old guys are the chemotherapy agents. The drugs that are effective in myeloma are largely called alkylating agents or anthracyclines. The old guys, the oldest ones, are the alkylating agents. Melphalan, cyclophosphamide, and most recently bendamustine. These drugs are not particularly active alone, but when used in combination with some of the other agents we're going to talk about, such as steroids, immunomodulatory agents, and the proteasome inhibitors. The drugs at lower doses have very few side effects, may affect the blood counts, but other than that, and occasional nausea, are pretty well tolerated when given for a few days a month and can be quite effective for a long period of time, but only really when combined with other agents and classes of drugs used to treat myeloma today. The other major class of chemotherapy agents used to treat myeloma today are the anthracyclines. The old drug was doxorubicin. In the last few years, we've used a newer version, a safer version, which seems more active. It's called Doxil or pegylated liposomal doxorubicin. It's like having the drug in a fat globule. It can be given very safely and very actively to treat myeloma patients today. As a single agent, when given alone that is, it doesn't have much activity. But when combined with steroids and especially proteasome inhibitors, such as the bortezomib Velcade or the carfilzomib Kyprolis, it's quite active. Also true when given with immunomodulatory agents, especially the Revlimid and more recently the Pomalyst. When the drugs are given conventionally once every 3 weeks, they can wreak havoc in terms of causing mucositis. Your mouth can hurt and blister and be red. And you can also have red hot hands and feet, especially on the palms and the bottoms of your feet. And that can be quite troubling. We know that that can now be reduced when we simply give the drug at lower doses more often, which we commonly do in our clinic today, and we no longer see these problems with red hot hands and feet and mouths that hurt. This isn't the case anymore. Again, these drugs are commonly combined with other agents, the steroids, the proteasome inhibitors, and especially the immunomodulatory agents. They're quite active, and they really can cause very little side effects. The other side effect that may occur long term, but we really don't see it much anymore because we give pretty low doses, is heart failure. So it's important for these patients to have their heart function checked with either what we call an echocardiogram or MUGA scan before they initiate this type of treatment.